Hi, Dr. Martin Rutherford here, certified functional medicine practitioner and other things. We're going to talk about one of my favorite subjects today. So, and then some people are going to be like, you're really weird or whatever it is, but we're going to talk about the gallbladder today. This is like the continuation of the functional medicine back to basics. Again, for those of you who may just have seen gallbladder, and I don't know yet what we're titling this, but for those of you who are just looking at gallbladder, maybe this is the first time, this is one in a series of presentations on what classic functional medicine should look like, and the emphasis is on the fact that there's a hierarchy to functional medicine and the way it should be approached. And we've been through that hierarchy from the very beginning of how to even evaluate a patient as to whether they should be a patient, to what the basics are, to what are called the priorities of blood sugar and oxygen. And those of you who've been watching know what I'm talking about. So we've gone through the intestines, we've gone through leaky gut. We've gone through chemical sensitivities, pancreas, stomach, we've gone through ulcers, we've gone through all that in an organized fashion. There is a hierarchy as to the way you should address a person's overall case, and there's a specific hierarchy within the framework of that as to how you should address gut function. There's like 35 different things that can cause gut issues, and a lot of people today know functional medicine as, I do the 4R program or the 5R program for the gut, and I got on the autoimmune paleo diet and I took a bunch of supplements that I got on Dr. So-and-so's thing for leaky gut or SIBO or whatever it is, and didn't work. So what's going on? What's going on is the person didn't follow the hierarchy, and in hierarchy of trying to get an intestines under control, any of the things I just got done mentioning, there's a couple of major players that if you miss them, you can do all the intestinal permeability you want, you can do all the liver flushes you want, you can do all of the SIBO diets and supplements and all that type, and you're not getting better ever. And one of the two biggest things, and those of you who've been watching know what the other one is, hydrochloric acid in the stomach. One of the two biggest things that if you don't fix, if you have it, you don't fix it, you don't know you have it to fix it, it's missing and you don't fix that, how can you fix that? We'll talk about it, okay? Then you're not getting better, is the gallbladder. The gallbladder is like ginormously important to us. You wouldn't think so with a gajillion gallbladders coming out. I think it's God, how much is it? 75,000, I forget. I actually have notes in front of me today. I don't usually use notes, okay? But the gallbladder to me is so huge, it's so important that I really want to, I'm not good at statistics and stuff like that. I'm not great at numbers. But I really wanted you to get the whole idea of what's going on. Now, most of you know, so I'm gonna be looking down and reading off my notes. So if that looks unprofessional, then too bad. This is where we're going to do it. So what does gallbladder do? Okay, what most of you know that gallbladders break down fats. Most of you know people who've had their gallbladders out, and it's like, oh, they had pain. They took the gallbladder out, the pain went away, and then it came back. Or sometimes the pain went away and stayed away. But I don't see those patients. I see the pain where they took it out, it came back. They took my gallbladder out, the pain never went away. And gallbladder shouldn't come out anywhere near as frequently as they're coming out, like 90% less frequently than they're coming out. And I'm not exaggerating when I say that. They do a lot more than fat digestion. It does change your cholesterol. So cholesterol is kind of accumulates in your liver. It has to be broken down so that it can get into your system, and then and that's done by bile salts, and that's done in your gallbladder. Those of you who can't eat fish oils, okay, those of you who can't, it helps to break down, and it helps with the absorption of fatty acids. So it helps with the absorption of your fat-soluble vitamins, not just the fish oils. not just A, but also vitamin A, vitamin D, vitamin E, vitamin K. So if you're taking all those things, and they're coming out the other end, or if you're taking these things, and you still have flaky skin, and then you're either not taking enough or you're not breaking it down and absorbing it. The gallbladder is one of the biggest reasons that you may not be able to take that. The symptoms of gallbladder are patients will come in here and I'll I have an assessment format people put out, and there's a whole section on gallbladder. First question is like, what happens when you eat fried foods, fatty foods? And a lot of people just leave it blank, or they go nothing. And I have to ask them and say, because it's a 0 to 4 scale, 0 meaning nothing ever happens. So they mark 0. I'll always ask that person, is that because you don't eat fried foods and fatty foods and things like that? And most of the time they'll say yes. Why? Because it makes them not feel good. It makes them not feel good because their gallbladder's not working, okay? Some of the bigger ones for gallbladder are, I can't do fish oils, can't eat fatty foods, gas and bloating and distension a couple of hours after I eat fatty foods. But then a lot of times they don't realize it's the fatty food. Big one is can't take supplements, can't take the fish oil supplements. Burp up fish oil. I burp up fish oil. I burp up a fatty fish oil after I do it. And one is really interesting. Two that are really interesting are itchiness in the palms of your hands and just general itchiness. I just itch all over. I don't know why, because your gallbladder, when it's not clearing things, those bile salts and the toxins from not getting cleared and getting into the intestines, they got to go somewhere. Some of them make it because not having a gallbladder will also cause constipation. One of the things that can cause constipation. So if it's not getting, if you're not clearing those toxins, if you're not clearing those bile salts into the toilet, and you can only clear so much through your kidney, it's going to the skin. It's going to itch. That's like to me like one of the biggest things when I see like itchiness all over. It's kind of generally the other one is like dry, flaky skin, which can be thyroid. It can be a lack of essential fatty acids. I don't eat enough nuts. I don't eat enough fish. I don't eat enough olive oil. I don't eat that stuff. But then if the person's going, well, I eat all that, then it's not getting broken down. It's not getting through the intestines. It's not getting into your system. You have dry, flaky skin. And so all of these are potential signs of gallbladder. The gallbladder helps with the secretion and detoxification of a lot of different things. One of the biggest things it helps detoxify in women is your estrogen. A lot of women who are like estrogen dominant, they may just have bad liver and bad gallbladder. I have actually an employee here, and we were doing kind of a little bit of a beta trial here on the program. Those of you who saw my New Year's my New Year's talk or my New Year's presentation, my New Year's card to you, my verbal card to you. We talked about how we're working on different level programs that maybe we can offer that are more amenable to people who can't get here. People who are wondering whether this actually works or not, and so on and so forth. So anyway, we tried it on all of our staff members here, and I have one staff member here who got her period within like 2 weeks, just detoxing, just in the initial detox phase of one of the programs we're considering, because it detoxed her liver, it detoxed her gut, and it detoxed her gallbladder. And all of a sudden, she started clearing excess estrogen from her system because it was stuck in her gallbladder and was stuck in her liver. And she got her period back after 2.5 years of not having a period. And she was kind of happy about that. But so the gallbladder is a big part of detoxing your estrogens. Now, is that a big deal? Yeah, a lot of you women know too much estrogen is not a good thing. It gets in your cells. Ultimately, it can lead to cancers, but long before that, it can lead to you getting, it can imbalance you, and you can get depression, and you can get all kinds of things from the gallbladder not working. And if the gallbladder doesn't work, the gallbladder, and we've talked about this, the gallbladder has to work to actually activate the pancreas and to and then to activate the now expanding understanding of the microbiome. It actually helps to cause the immune aspect of the microbiome to work better. And that's because the gallbladder actually puts out enzymes that help your immune system. So the gallbladder is a big deal. The gallbladder works with the pancreas to decrease or prevent and decrease inflammation in the intestines. So you can kind of see why this is one of my favorite subjects in a sense of, and I just had one the other day. Again, I say that, but this is what I do. And the other day, I have someone come in and they haven't been, they went through our program, and then this was about 3 years ago, and they were doing great, and then apparently that stress is in their life, went off the diet. I mean, came in and just vomited all this out. I went off the diet, and I just got back on it 10 days ago. I'm feeling much better. The final diet that we had come up with for her, she says, I've been kind of on and off with the supplements, and so I kind of, and we have when we're done, we tell people what supplements you should take. We try to get them down to as few as possible. But the ones we tell them to take, they better take. And one of them was gallbladder. And one of them was gallbladder, and the other one was hydrochloric acid. The two things that I just got done saying, your problems will come back or they'll never go away if either one of those aren't working right. And sure enough, she had, the assessment form was all marked up. She had stomach symptoms, she had pancreas symptoms, she had gallbladder symptoms, she had gas, bloating, blood sugar symptoms, she had thyroid symptoms, she has something called Hashimoto's. And when we finally came down to it, it was her gallbladder, and it was her hydrochloric, and it was her stomach. So we told her to start the hydrochloric acid again, and then we'll talk about what we do for gallbladders, what you can do for gallbladders, and she's going to do that. I'm going to see her in 2 or 3 more weeks. I almost guarantee, and she's going to go back on her diet. I almost guarantee you she's going to be fine, even though the whole thing blew up. Okay, so it's a big deal. The estimates are like 10 to 15 to 20% of people in America have gallbladder problems, and that's kind of, it's interesting. There's different cultures. Those of you who might be Indian Americans or Mexican Indians or Canadian Indians, I don't want to get into the whole reasons why on that and the politics of it and all that. Like 70% of female Canadian women, of Indian descent, American Indian descent, and Mexican Indian descent get gallbladder problems. And it's a lot more than what they eat, all right? But it's kind of interesting. And then there are other countries, you go to Africa, it's like nobody gets it. And there's reasons for that. So so this country, it's about 20%. About 20% of people get gallbladder, and it's a lot to do with stress, and it's a lot to do with our diet, and it's a lot to do with, we probably eat like 7 tons of food by the time we're like 55 years old. So, but whatever it is, you want it working, okay? It's the most common cause of elective surgery in the country, at approximately 750,000 surgeries per year. That's almost 1 million, okay? I'm just going to use that as round figures. 320 million people given, it's like 1 out of 300 people, something like that, gets their gallbladder taken out. Not just gets a gallbladder problem. Okay, 20% of that 325 million get gallbladder problems eventually. But 1 in 30 gets it taken out approximately. Okay, that's a lot. Okay, that's not like, that's like not 1 in 10,000 or even 1 in 1,000. That's a lot. And it really shouldn't be taken out. What happens is gallbladders, how they break down because of stress. Stress just causes your intestines to slow down when you're in fight flight. Your nature has provided us this mechanism that says, don't poop, don't eat, don't pee, because you're in fight flight. You're supposed to be fighting or fleeing, not pooping or peeing or eating. So it kind of shuts down your throat. Those of you who have trouble swallowing pills, look at your stress response. It shuts down your stomach. It shuts down the ability to make hydrochloric acid. It slows down your gallbladder. Stress is the #1 cause of constipation. Constipation can be a lot of things. Not lack of hydrochloric acid and poor gallbladder function are among those things. Okay, stress shuts down your urinary tract. So stress is a big cause of it. Obviously, eating like a lot of junk is a big cause of it. Illness is a big cause of it. Illness can slog up your liver, and then that can kind of gunk up your gallbladder. In fact, you long before you get a gallbladder problem, you get sludge in your gallbladder. It's interesting. I have another case right now, and we've been working that case down for several months, and in the case is like probably 90% better, even better than I thought it was going to be. And it was funny. We were down to almost our last visits, and I was like, and I keep looking at this assessment form, and everything's clearing out except the itchiness. And I'm going, you have a gallbladder problem? He said, no, they checked it out. I don't have a gallbladder problem. My gallbladder's fine. It's ejecting. I said, I'm telling you, you have a gallbladder problem, because that's what's causing your whole body itchiness. No, I've had it my whole life, and it comes and goes. I'm like, we're gonna work with your gallbladder. So, and at that point, because we had already figured out so many other things about chemical sensitivities and pathogens and fixing your gut and everything, and that's the other thing. That's the other thing. The gut problem that was gone was starting to come back, and I just got done telling you, fix the gallbladder. It's coming back. So all we did at this point was we gave this person a couple of supplements. Literally within 4 days, the itching went away. The gut problems, the intestinal problems, I tend to use the term gut, and that's very broad. The intestinal problems that were starting to come back, the gas, the bloating, gone. I suspect that was the last piece to our puzzle. We're not always fortunate enough to get the whole person's whole system to get functioning again, but in this particular case, that gallbladder was the last thing. Now, my point of that was going to be this. Tests were normal. I did lab tests on them. Her gallbladder stuff, called the GGT, was normal. Her liver enzymes were normal. They had checked her for gallbladder. Her ejection fraction was proper. What does a gallbladder do? It just basically is a holding tank for this bile and for toxins out of the liver. And it just when it gets the signal from the stomach to that it needs to do something, it goes and it just squishes out bile, okay, into the intestines, and then that does all the things we talked about before. So long before you get a stone, we'll talk about that a little bit, long before you get a stone, okay, you get sludge. There's no test for sludge. I shouldn't say that. You can do an ultrasound, and depending on how much sludge you have in there, you might see it and you might not. So you can go in there, have an ultrasound done, and they go, it's perfectly normal. They do your ejection fraction, it's perfectly normal. Lab tests, perfectly normal. That's why we use assessment forms. The assessment form says that the person was having a little trouble still with a lot of trouble with the itchiness, a little bit of trouble still with a little gas 4 hours after eating, and one or two other things I can't remember. But the assessment form said there was a gallbladder problem. Symptoms can come on 5 to 10 years before you see anything in testing. So this is a problem. This is why those of you who have your gallbladders out, and we'll be talking to you a little bit about that, are going like, why did they take my gallbladder out? Or why didn't they know? It's because we don't take enough time to do what we're talking about in this functional medicine back to basics, which is, if you walk back, we talked about how you have to do a history and exam first. And again, we're trying to put together protocols and figure out how I can be comfortable that that person's going to give me enough data to be able to tell them which program would be best for them. In other words, if you're going to do a lesser program and I'm not going to be involved, or I'm not going to be involved very much, or I'm going to have one of my colleagues here at the office be involved, I want to know that if you're going to be doing this program, that there's if there's a cost involved, if you're going to be spending your time, your effort, you're going to trust this, and you're going to pay us, I want to make sure there's an awfully good chance that you're going to get improvement from that particular program. And so we're trying to figure that out, and that assessment form is I think is going to end up being a part of this. But because long before that, you're going to get bloating, you're going to get distension, you're going to get burping after meals. You might get the gallbladder pain up here. You might get in the upper back pain. You might just get chronic digestive issues. You might be getting an inability to. Now you're avoiding fats. You're avoiding like eating fatty fishes. You're going to sushi. You're going like, oh my God, like why did I eat that hamachi? And it's like, the overall itchiness, the bitterness, the bitter metallic taste in the mouth. That's a big one. That's your gallbladder bile coming back up into your throat. I get that now and then if I eat too much. Not that I ever eat too much. And so these things will happen sometimes 10 years before anything shows up on an ultrasound. All right. So bottom line, you will never be able to restore a healthy gut and microbiome function if you don't resolve a gallbladder issue that's there. So let's see, what else do I want to tell you about gallbladder? I think that's kind of like the basics of the background of gallbladder, okay? So what do you do about it? So you got a bad gallbladder. So the medical profession, what do you do with the medical profession? The medical profession has some drugs that will break up. So the medical profession usually doesn't get involved until they see something on the ultrasound. Okay, the position there is the position there is we're going to look and see if there's sludge. We're going to look and see if there's stones. We're going to look and see if the gallbladder is not pumping right. We're going to look and see if the gallbladder is becoming gangrenous, and obviously, well, not obviously, but if it's becoming gangrenous, that predisposes you to the potential of cancer. That's what they're looking for. Okay, that's called pathology. If you go in there with a bitter metallic taste in the mouth and I can't eat this, they're not going to do anything. I can't eat fatty foods and stuff. They're not going to do anything because that's not the basic standard protocol locally or nationally in the healthcare field. It's like they want to see something. They want to see liver enzymes up on the test. Okay, they want to see gallstones. You can have gallstones and not have any of these symptoms, and that can happen. And they'll take your gallbladder out. Okay, you're gonna have every symptom of gallbladder function and not have gallstones, and they'll go, it's not your gallbladder. So I'm not being a jerk, by the way. Those of you who watch me, I'm not against the medical profession, but I've made the point many times that the medical profession, as it's developed, is more of an acute pain, acute condition situation, a pathology situation. Let me kill it. Let me take it out. Let me do something like that. That's what they do. Okay, and so if you got that stuff, that's where you want to be. If you got this stuff, that may not be where you want to be. So the other things that they do is they have kind of bile sequestering drugs that help you to bind your fats because you're not absorbing them. And then the other thing they do is they take it out. They do have a medication that they can use. To kind of unsludge it. Long before you get stones, you get sludge. Sludge is manageable. Even stones are manageable. Okay, and we're going to get into that to a little bit. So that's kind of where the medical profession is on it. Probably before that, I should have showed you this. I thought this was would be fun to show you, and of course, I pulled out the wrong thing. No, here it is. Okay, so I thought this would be fun to show you. So this is back in the 50s and back in the 60s and back in the 70s. This was how you determined whether a person probably had gallbladder problems, okay? And I'm going to show you what the modified one looks like, but I thought it would be fun to show you that it was female. They said it was being female, fat, 40. They used the term fat, and that was pretty much like, okay, that person and has a gallbladder problem. And then today they've expanded it. They've expanded it quite a bit. Okay, they've expanded it once, and they have expanded it twice. Why am I showing you this? To show you that there's a lot of interest in the gallbladder now because people are starting to get how significant it is. So risk factors for gallstones, there's just a ton of them here, so I'm going to read them. Mostly female, more being female, being 40, being overweight. They've changed it to having a high BMI versus calling you fat. Being a Native American, we talked about that, Mexican American, Canadian American, being overweight or obese, losing weight very quickly because you're just not absorbing anything, because you're not breaking down a lot. Because when your gallbladder is not working, it's not only not breaking down the fats. When it's not breaking down the fats, you're not absorbing them. But the gallbladder also has to alert the pancreas to start working. So it's a chain: stomach, gallbladder, pancreas. You pull the plug on the stomach, the gallbladder and the pancreas doesn't work. You pull the plug on the gallbladder, the pancreas doesn't work. Pancreas doesn't work. You don't break down other nutrients. They don't get absorbed. You start getting like malabsorption, and then you start losing weight quickly. Being sedentary, got to get up and move around. One of the things that you can do to like get your gallbladder like working good is exercise. Being sedentary is bad. Being pregnant's bad. It's not bad, but being pregnant during a period of time that you already are compromised, you have all the symptoms, nobody knows you got a gallbladder problem. Being pregnant, because it puts a lot of stress on the system, that can bring it out. Eating a high-fat diet, eating a high cholesterol diet, obvious reasons, okay. Eating a low-fiber diet, fiber moves the fat through. So if you don't have any fiber, it sits there and then it overwhelms your gallbladder. Having a family history of gallstones, having diabetes, taking medications that can contain estrogen, we briefly talked about that, such as oral contraceptives or hormone therapy drugs. So that's big. The drugs that can cause gallbladder problems, we talked a little bit already about estrogen. If you're taking, especially if you're taking estrogen creams, because you put them on and it's hard to dose those, so they get absorbed into your fat, they go into your system. Usually you're going to be taking too much of those. Okay, a lot of problems with estrogen creams is they put you into estrogen dominance. There's not a good way to measure it. So what happens is estrogen is supposed to be used, all hormones. You make them, they're supposed to go where they're supposed to go, do what they're supposed to do, then they're supposed to go through the liver and the gallbladder and the intestines, and they're supposed to be detoxified through those three things, and then they're supposed to end up in the toilet. Okay, that's the hormone cycle. If you have constipation, they're not ending up in the toilet. If you had a bad liver, they're not ending up in the toilet. If you have a bad gallbladder, they're not ending up in the toilet. And if they're not ending up in the toilet, they're ending up in your liver. They're going to end up not being digested properly through your stomach, or they're going to get into your fat cells. Fat cells are estrogenic. Men and women, they absorb fat, and so it puts a tremendous demand on the liver. And again, as I discussed on that one case, that's what happened to the one case with the staff member here. We just cleaned her out. We cleaned out her liver, we cleaned out her gallbladder, we cleaned out her stomach. All of a sudden, her estrogen balance came back into normal, and she had her period. She came in and she was like, I just had a period. I'm like, well, that's good. You're like 40 years old. That's okay. She said, no, you don't get it. I haven't had a period in 2.5 years. And so, and they've been normal since. I mean, I was like 6 or 7 or 8, I don't know, I forget, 6 or 7 or 8 months ago that happened. So estrogen drugs, we'll call it statin drugs. You got to look into statin drugs. I will admit, I'm kind of like not a statin drug fan. There's so many other different ways you can get your cholesterol down. And statin drugs, I had a gentleman in here the other day and he was taking statin drugs. This doctor hadn't given him CoQ10. His muscles are cramping up. You know, the statin drugs do so many things, but one of the biggest things it does is it decreases your cholesterol, and then it alters your abilities cholesterol to synthesize into bile. That puts a strain on your on your gallbladder. Next thing you know, you get sludge. Next thing you know, that goes into stones and so on and so forth. Diuretics will also increase the biliary cholesterol saturation rate. So you'll get too much being absorbed, and then that gunks up the liver and the gallbladder. Antibiotics just increase sludge. I talk about sludge. Sludge is sludge. It's all these toxins and all the bile in the liver that just gets thick, and it just won't go through the bile duct and it won't go in. Antibiotics alter gut function significantly if you haven't like taken a probiotic or something like that to get your gut function back, if you're even able to do that, because if you don't have good hydrochloric acid and you don't have a gallbladder, good gallbladder and stuff, sometimes that might be hard to do. But if you can't get it back, then the antibiotics themselves will actually increase demand on your gallbladder. You get the sludge, you get all the symptoms. They take an ultrasound. Maybe they can see the sludge, maybe they can't. If you can't see it, then you're screwed. And we talked about statins already, and that decreases gallbladder motility. Those are the big drugs. Those are the big drugs that you have to look at. Everybody comes in here. I have a list of drugs, and I can't remember them all. So I have a couple of sheets that I've had put in plastic, so I can look at them. I have 2.5 sheets of drugs that screw up your thyroid. I have sheets of drugs that screw up your gallbladder. Because if you don't look at those before you start a case, now if we go back to basics and we go into priorities, if you don't look at those before you start a case, and you got a gallbladder problem, and they're taking 3 of these drugs, and you're trying to give them some bile salts or something like that to get rid, it's not going to happen. So another clinical pearl there. So you need to understand that. So let's see. They use medicines. Okay. So we already went over. So you get a gallbladder. Basically, you get the gallbladder from one of these many mechanisms we talk about. The gallbladder starts to slow down. The gallbladder doesn't, and then you start to get sludge, and then ultimately you start to get small stones, and then later you get larger stones. If you get a stone stuck in the duct, this is the duct, this called the cystic duct. If you get then they have lasers that can blow those stones up, and you don't have to have your gallbladder taken out. They use medications, but for the most part, if you have stones, they're taking it out. Okay, so it's medications taking it out, so on and so forth. It's sludge, it's stones, it's blockages, then it's and somewhere along the line, somebody does an ejection fraction on you, showing that your gallbladder is slowing down, and then it's gangrenous, or large stones and gangrenous. That's kind of like the flow of it. Unless you get the gangrenous, all those other things can be handled. Let's see, what other things cause gallbladder problems? Brain injury can cause gallbladder problems. So this is why this is like one of my favorite subjects. I mean, look at how long I've been talking about this, and look at how many things are going on here. Okay, so like brain injury, a concussion can actually cause your gallbladder to slow down, because your brain controls your vagus nerve. Your vagus nerve controls the movement of your gallbladder. And if your vagus nerve gets inflamed, gallbladder starts not working. So now you're trying to fix the gallbladder, but you have like this post-concussion syndrome, and it's not going away. Neurodegenerative disease, like Alzheimer's, Parkinson's. These things notably cause constipation. They notably slow down the whole bowels. When that happens, gallbladder. Chronic intestinal inflammation will cause the gallbladder not to work, because the gallbladder has sensitivity to inflammation. We talked about oral contraceptives. Ovarian cysts. Those of you who have polycystic ovarian syndrome, it alters the amount, and it can increase your testosterone, or it can increase your estrogen. Those things will screw up your gallbladder. Let's see. I think that's it. I think that's all of the things that cause gallbladder problems. And so the gallbladder is like an interesting thing. It's because forever and ever and ever, it's just been like the gallbladder is like just pumping. We don't really need it. Just take it out. We'll give you a medication and we'll give you cholestyramine and you're good. Whew, man, no, no. So, okay, so I have a gallbladder problem or I have my gallbladder out. So let's go with I have my gallbladder out. Okay, I have my gallbladder out. What can I do? So here's the thing, hierarchy. If you have your gallbladder out, you know, and you have any of these things I talked about, you have neurodegeneration from Parkinson's, or you have it from maybe early dementia or Alzheimer, or you have it from brain trauma, or you have it because your whole gut's inflamed or something like that. Well, unfortunately, what you got to do is get rid of that, even if you have a gallbladder out. Okay. Well, I'm going gallbladder out. What does that have to do with anything? When you get your gallbladder out, you still have a duct that's called your cystic duct. Okay. This is a little duct. So the gallbladder pumps into this cystic duct, and then this duct dumps into where it's called your duodenum, where it's like the top, right outside of your stomach, the top part of your intestines. And that and the pancreas dump in, and then they help to digest stuff. That cystic duct becomes your new gallbladder. Okay, and it tries to do the gallbladder's job. It ends up expanding. It's a duct, so it's round, it's long, but then it ends up becoming like a pouch, and you can imagine, so that it can transmit the bile. Well, you can imagine when you got a gallbladder, and this old duct is trying to do what the gallbladder is doing. Maybe it's going to have a hard time doing the job. And so a lot of times what we see in here is the patient comes in, they have every single gallbladder symptom marked up. And I go, oh, you got a gallbladder problem. They go, I don't have a gallbladder. And I'm like, right, I see that on your chart, but you have this cystic duct. Well, you don't usually get stones at that point. Usually you have sludge in there, okay? And so it's pretty standard for me when people come in and they don't have a gallbladder because it's so important, they're going on some sort of a support for a gallbladder. I'm not treating them. If they have a gut problem, I'm not treating them. If they have problems that I have to get to through the gut, I'm not treating them. Because, what did I say? It's either not going to work or it's going to go away and come back. And so there are a number of supplements. There's ginger, there's capsicum, there's curcumin, there's fenugreek. Onion enhances the secretion of bile acids and bile salts. There's the liver stuff, the dandelion, the milk thistles. All of these things can help that to work. We use a couple of supplements. I use a number of different companies, but I use this one product from Apex Energetics is the company. And I think you can only get those through doctors though. And it's called Biomin, and it has several of these things in it. I usually will use Biomin and then another product called Lipomin. That lipo is like fat, okay? So those two things usually break it down. I usually have them take that for a month, and then I will have them take one of these herbs or botanicals forever because you don't have a gallbladder, okay? And this is probably one of the people call and go, what can you tell me to do? You know, this is like one of the things I can actually tell you to do. Okay, that's going to be good for you. That doesn't really depend on anything else. You just need to take this stuff. If you don't have a gallbladder, the chances are you've already decreased your fats and fried foods and carbs. And if you haven't, you should. You should decrease sugar. Like the diet, you know, whether you have gallbladder problems or whether you have a gallbladder out, it's like decrease your fats and oils. After what we talked about for the last 30 minutes or whatever it is or more, that should be a no-brainer. Fried foods, most of you are already not eating it. You know, decrease your carbs. Not having a gallbladder is not the best thing for people who are on the ketogenic diet, okay? So if you're on the ketogenic diet, you definitely need to supplement for your gallbladder, even if you have it, frankly, okay? Even if you have your gallbladder, you should supplement for that because it puts a demand, high-fat diet, right? It puts a demand on gallbladders. 20% of the people have gallbladders. That's all they know. Remember about the 10% that probably have gallbladder problems that they haven't even figured out has them yet, okay, which is probably more than that 20%. So you should be taking that. Sugars screw it up. You should increase your fiber. You can drink coffee. For those of you who can drink coffee or aren't stressed out of your mind, or you don't drink coffee and it makes you better, coffee can not be good for your stomach and your intestines, so you kind of have to gauge that. If you have an inflammatory bowel disease, don't drink coffee. If you don't have inflammatory bowel disease, you can drink coffee. Coffee enemas, I'm not going to go into coffee enemas. Yeah, they're good. All right, there's the no coffee enemas are bad, coffee enemas are good. They're good for this. They're good for this. I'm not an everyday coffee enema guy. Okay, but if you have a gallbladder problem, it'll get your gallbladder sludge moving. It'll get your gallbladder. If you got small stones, it'll get those out. There's tons of studies that'll say that will work. And I'm talking still to those of you who don't have a gallbladder. I'm kind of talking to both of you right now. I'll get into the people who have a gallbladder in a second. So anyway, so all of that increases your ability. For those of you who don't have gallbladders, you have a cystic duct that's trying to be the gallbladder. You need to support it. And bile salts, and I'm full disclosure, I just learned this like 6 months ago. I go to seminars all the time, and I know who's who and who to go to. I know who's a commercial guy. I know who's good at selling it. I know who's good at, but that's not where I go. I go to the people who have been in this since the beginning. The people who are doing the research. These people are money. Everything they've ever told me over the last 20 years has come to fruition. And they said, don't take bile salts. I've been tell people to take bile salts forever, and they work. But the position of my mentors, who you can trust with your life, let me tell you, is the bile salts are too harsh. Over a long period of time, they're too harsh. So you want to go more to these supplements, okay? So for those of you who have a gallbladder, let's go back. So don't have a gallbladder, you have a gallbladder. It's called a cystic duct. You just got to keep it moving, okay? You got to keep the sludge out of there. That's the way you do it. You can do it by exercise. Exercise is also really good because you're moving around. It increases vagal activity. Exercise is good for people who do and do not have a gallbladder. In fact, exercise is good for everybody who can do it if you find the right intensity level for you. You have a gallbladder. Here's the thing. Okay, you go to the doctor. You don't have. If you have the symptoms, you have the symptoms. If you have the symptoms, you're one of those people who's like, you're on your way to stones. Okay, you can get small stones. You can get large stones. As the stones are not impacted. It is not about what you eat for the most part. It's not about your imbalance in calcium and all that type of stuff. Okay, it's about these things that we've talked about. Excuse me. And so, well, it's about what you eat relative to that. You got to decrease your fats and your oils and your fried foods and your carbs and your sugar. So I'll take that back. So it is about those things. So you have to decrease those things. And you can use these herbs and botanicals, and these stones will disappear. Now there are I used to like attach all of the peer-reviewed journal references, but frankly, I just don't have the time to do that anymore. So, but you can look these studies up. You can look on PubMed. You can look on the dissolution of stones by natural means, and there are tons of studies out there that'll show before and afters of ultrasounds where the stones have disintegrated. Even large stones with spikes on them. Where you got to get it out because it's going to go into your duct, and then, well, I'll wait until it goes in my duct. Let me try this first. It will work. And so you can do that. You can do the exercise. You can change the diet. You can do herbs and botanicals, and those things largely are going to take care of the problem. You can do the old olive oil and lemon juice deal. It works, okay. There's a lot of controversy on it, but at that seminar, they presented a number of papers, and they showed a lot of studies, and they actually showed pictures of where the stones would come out, and they would show you that, what the stones looked like, and so on and so forth. And then there's the old coffee enemas. Okay, I'm not going to get into the details of coffee enemas, but I have sheets here for people. I use it for people who have severe gallbladder issues that are not resolving any other way, and I use it for people who have severe constipation. So I don't use it that often. Most of the stuff that we do, everything gets going. But there's studies that'll tell you the coffee enemas don't work. There are studies that will tell you they do work. So my experience and my colleagues' experiences and my mentors' experiences are they work for these types of things. I would do all of that. The only reason anybody's ever taken my gallbladder out is if I have a blocked duct and I'm getting a lot of pain, that's okay, because I'm going to go in there and I'm going to go use a laser, get it out of there, and I'll do what I need to do to get rid of all the stuff that's in the gallbladder so it doesn't happen again. The only reason it's coming out for me is if they tell me I got gangrene in there and I'm going to or it's on its way, or it's cancerous. That's the only way it's coming out for me. So I'm not telling you what to do. I'm just telling you what I would do. Okay. So that's gallbladder. I mean, that's pretty much gallbladder. And I talked a lot. I can go into this in much more enormous detail. But this is like my favorite subject, because people come in here all the time, and we're doing this, right? We're sharing all this stuff with you, or people on there hawking their products for your fibromyalgia, or for your intestinal cleansing, or for this is going to cure that, and you do it and it doesn't work. This is one of the biggest reasons those things don't work, because if it's there and you don't take a direct hit on it, or you're taking these drugs, or you have brain injury, or you have neurodegeneration that's causing it, or something like that, it's not getting better, your gut's not getting better, which means your immune system's not getting better, which means your fibromyalgia is not getting better. This is a big deal. And so that's why I took a little bit more time. I actually put the notes down. I thought it might be fun to see what in the 50s and 60s, they just told you were fat. You're fat, you're 40, and you're female, you have a gallbladder problem. So I come from that time, so I have to watch it. You're obese. I'm not sure obese is a whole lot better. So, but that's gallbladder. So I really was kind of excited about doing this today. That's my weird world, okay? Like Dr. Rutherford was excited about talking about gallbladder. But this has broken more cases for me than I can even tell you. It's really important. Okay, so that's today. Gallbladder. We're going to move on next time. I think next time gallbladder and liver are kind of together, but liver does they used to tell us 350 things. Now it's like 500 things that the liver does. We're going to get into the liver. Liver's another big one. Okay, people have been doing liver detoxes since forever, for 5,000 years. And there's a reason for that. But again, the liver will only get better if other things are done along with it or first. Although in a lot of cases, it's a good place to start. We'll talk about all that. We'll talk about liver, and we'll talk about it. It's how to determine whether it's liver or whether it's other things. And so that's kind of a cool one too. So I'll be looking forward to that. So until next time, Dr. Rutherford, send me your questions, send me your comments. Unless they're on my hair, then I'm not interested in them. And then we'll keep going in this vein until we have you totally schooled up on being the best functional medicine practitioner you can be. Take care. We'll see you next time.